Hi, welcome to our first guest speaker in our guest speaker series for Concussion Recovery online membership group. Today, I'm really excited to introduce to you Mandi Mack. She is a registered massage therapist, and she has 17 years experience in working with complex cases. I'm really excited to introduce her to you today. Her approach is unique in that it blends Eastern and Western medicine. She blends the wisdom of the East, the West, and Indigenous peoples using Eastern therapies like Ayurveda, traditional Thai, yoga therapy, and each session she uses a trauma-sensitive approach while focusing on regulating the nervous system, which, as you know, is really perfect for post-concussion situation, traumatic brain injury, anything like that. In addition, she's a passionate multi-potentialite, which we'll ask her what that means. She's a multi-passionate entrepreneur, curious rebel, spiritual adventurer, transformation leader, shamanic practitioner, and the creator of Vedic Smudge. I've known Mandi for probably 9 years now, and I can say from personal experience that she really is an exceptional healer and practitioner, and I'm really excited to introduce her to you today. So what I'm going to do is I'm just going to bring her in. Maybe. There we go. Hi, Mandi. Welcome.
Hi, Jenna. How are you today?
I'm good. And you?
I'm doing really, really well. I'm excited to talk to you today.
Me too. So I just introduced to the group a little bit about your background. And what I would love to maybe start off with is, what is a multi-potentialite? That is fascinating.
I get that question all of the time. So what a multi-potentialite is someone who is interested in a multitude of things that are often at odds with each other. So one of the really easy examples I like to give people is when I first started in massage therapy, I was in school. And while I was in school, I was doing sales in electronics. And for me, the idea of being in sales and understanding stereos and televisions and all things sort of technology was very exciting, as was learning about the body and how we help people. So there's an example. So a lot of times people will reference people like Michelangelo, for instance. So beautiful mathematician and incredible artist at the same time. So
that's wonderful. I absolutely love that. And I think a lot of us are quite a bit like that as well. And I do find myself I often bounce between loves, right? Yeah. Professionally, I love this, and I love that, and then I love this, and then I love that, and I'm always looking for ways to at least try and link them together.
Absolutely.
That it makes sense.
Yeah. Well, and I think that's it. A lot of times we have this idea that we should like one thing or we should like the other, or if we like one thing, it sort of takes away from wanting us to like something else. So it's really the harmony of these contrasts and how a lot of really beautiful things can come from that as well.
And that's fantastic, because it also it's also an integrative approach, right? So when we're looking at anything to do with the medical community and looking at integration of different philosophies, it pulls that in as well, right? So integrative therapies don't necessarily mean it excludes the medical side of it, but it includes other philosophies, right? The medical system as we know it is pretty young in comparison to some other methodologies from across the world. And so when we're dealing with post-concussion syndrome over the years, the realization that in order to really effectively, in my opinion, work with someone's symptomology is to pull things together and really create an integrative philosophy when dealing with each person as an individual, when we're looking at dealing with their concussion symptoms. And even now, the British Journal of Sports Medicine for concussion, every 4 years they bring out a new journal. So this year they'll be bringing out their next edition. But even now, when they're looking at mild traumatic brain injury, sport concussion, they're often saying the last 2 journals made comments about having more of an integrative approach when coming to post-concussion syndrome symptoms. Because at the end of the day, you have to sort of figure out a variety of ways of pulling it together and making sure it works to the best benefit of the client. So the group, I've already introduced myself to the group in previous chats, but I'll do it again for anybody who hasn't met me before. My name is Jenna Howe, and I work specifically with post-concussion syndrome. I use a technique called Bowen technique and the concussion recovery protocol. And over years, I've pulled in other modalities and methodologies in terms of dealing with post-concussion syndrome and the client. The reason why I'm bringing Mandi into the conversation today is to talk a little bit about massage therapy, its role in post-concussion syndrome. For me, it's been a bit of a challenge because I found that in my situation, I would often get people coming to me after they've had not the best experience with massage therapy. And then on the flip side, trying to figure out ways to blend massage with what it is that I do so that the client gets the best benefit. Because the reality is that a lot of people who are getting therapy for post-concussion syndrome is post-car accident. And so they're in litigation or they're with ICBC. Well, I'm in British Columbia, so ICBC or their insurance company, and they're mandated to do massage. And so trying to figure out ways on how do I make this actually beneficial for the individual? So a bit conflicting, so trying to figure out what to do with that. So Mandi, my question to you is, as a massage therapist, what did you notice that you needed to do differently with your post-concussion clients?
Mm-hmm. Well, absolutely. And I just want to sort of jump off of what you had already said. In massage school, we're taught to work with the physical structures. We're taught to work with muscles, with origins and insertions and hypertonicity and trigger points. Whereas as I started working in my personal practice, I found that a lot of times if people came in after a car accident or a sports injury, when I was treating the muscles were just not ready to be treated. They weren't able to receive physical treatment in that way. So very quickly, early on in my personal practice, I recognized that it's definitely not about meeting the muscle and trying to work through it. And I think that's one of the really unfortunate overarching therapies or theories in massage therapy a lot of time is like no pain, no gain, let's get in there, let's dig it out, let's force it, let's make it happen kind of thing. And I knew even prior to becoming a massage therapist that my personal body experience, and I grew up in sports and that sort of thing, so I had some pretty beautiful injuries along the way. And I can actually remember having whiplash at one point and literally getting migraines after massages and it being just a horrific experience. And then having a completely different technique approach come in and it being very, very gentle and finding that the headaches didn't happen. And in fact, I actually had a little extra relief and I recovered a lot more quickly. So once I started in my own personal practice, I'm trained in lymphatic drainage. So that was kind of one of the first things I started experimenting with, was using lymphatic drainage if somebody came in with an acute injury instead.
Yeah, well, that's fantastic. Yeah, and you know, I wasn't an athlete as a young person, but I also remember dealing with migraines post-massage, and it's conflicting. Yeah. Because you want to go to massage to feel better, but then you come out with a migraine, you know, the next day or 2 days later, and you're like, okay, wait a second, that makes no sense. But then everyone's telling me I need to go get a massage.
Yeah.
And what do, right? Especially if you're in a situation where you're not getting a ton of guidance. There's no real checklist of who you're supposed to see or what you're supposed to do when you go to the physician and say, I've been injured, either in a car accident or sports injury. There's no checklist to say, okay, do this, not that, do this at this time, and so on and so forth. So it's really great when you have personal experience of what the client is going through, so that you have a better understanding of, okay, this is what needs to be done.
Yeah, absolutely.
So adding lymphatic drainage to the treatment plan, was there any other approaches that you chose to utilize in order to get the results that you do?
Yeah, definitely. So I've been in practice for quite a few years, and that's one of the things I love about massage therapy, is that we have continuing education that we do every year. And for me in particular, I really allowed my clients to guide where that was going. So as I had new injuries come up, I continued to do more and more training along the lines of that. So in terms of the approach that I will actually use is actually nervous system first. So over the years, what a lot has come up for me is trauma. And I'm not talking just physical trauma, also emotional trauma, spiritual trauma, and that sort of thing. And what I started noticing is that while working with the nervous system, I was also getting responses and results from people with like chronic problems because of things like concussion or otherwise. And so it was actually really interesting. It was a fully kind of like happy accident that happened. I had a client that had come in after a car accident, concussion, whiplash, that sort of thing. And this was after I learned more about the nervous system and the multiple approaches that I could use. And I basically said, okay, well, let's work with your nervous system first. And they had extreme pain at that time. They were nauseous. They were having a hard time with focusing their eyes at all times. And after balancing the nervous system within one session and just working with relaxation, they ended up walking out of the room with having incredible results. So that was kind of my little peek in to go, okay, what other things can we learn about this?
Well, that's amazing. And I think that will give a lot of people in the group some comfort, knowing that there are people out there who can help them, because I do know that sometimes I get people who have been suffering for 2 or 3 years, and not one single practitioner has addressed their nervous system in any capacity, or have addressed their lymphatic system in any capacity. And I find it mind-blowing, because I've just created this little bubble of what it is that I do, right? So having people coming in who have just been dismissed in a certain way, forgotten about, oh, well, it's been a couple of years, well, you're just going to have to live with the pain. And I'm like, whoa, wait a minute. No, you don't have to live with the pain. There's definitely ways around what's happening for you. So that's really fantastic.
Yeah. Well, I think it's unfortunate too, because I think in a lot of different types of training, and I've seen this similar to yourself, I'll have clients come in 5, 6, some 10 years. I had a client that had literally had headaches off and on for 10 years after an accident. And we're told by the doctors, by the different practitioners they were working with, like, you just got to live with it. And for me, that was absolutely heartbreaking to recognize that they were given this diagnosis and they needed to take pain pills to sleep at night, and be in different types of positions and that sort of thing as well. So, and it's unfortunate, because I think training, you are taught sort of like, it's like that nail hammer analogy, when everything you look at, it looks like a nail, the tool you're going to use is a hammer, unfortunately. And I think it almost goes back to that multi-potentialite perspective, right? Where it's like, well, if something's not working, can we like look outside of the paradigm in which we've been trained, or in which we're thinking and what feels safe and comfortable, and see if there's a solution that's out and beyond that as well.
Exactly. Yeah, it's definitely important, not only for practitioners to think outside of the box, but I think clients as well, because I think you and I both experience people who, when they come to us, we're their last resort. They're skeptical. They've been told under no certain circumstances they're never going to get better. So what are you going to do differently, right? So there's a lot to unpack there for somebody who then leaves the office and goes, do I actually feel better? No, I don't actually. I can't possibly. And then they get ticked off because they had been told for several years that they were never going to feel better. And then they're like, and here I am feeling better. So I think it's really important for people to understand that there is potential out there, there's hope out there, and you know, our purpose as practitioners is to be able to help people and guide them to wherever they can go to create a network of people that they can go see in their community. So that's my ultimate goal, is to be able to say, okay, you're living here, go see this person. And I often get people who contact me from Toronto, and so I'll just say, okay, well, right now you can see this person, and then go see this person, and then go see that person. And then if those three combined, you should be able to pull it all together.
Yeah, absolutely. And that's actually one of my philosophies as well, is I believe we need a team in order to support our wellness. And it's something I advocate strongly because I have it myself. Like, I have multiple massage therapists, nutritionists, naturopaths, homeopaths, mainstream allopathic doctors, osteopath. You know, I have a full team that I know works really well for me. And I think to feel empowered to be your own advocate in your own health is one of it too. And I think that's a big thing that's shifting within our generation right now, is we have access to information, we have the internet, whereas generations of the past sort of just trusted what the doctor said and went along with those lines. And if that's what was told, then, you know, that's sort of where you're at. Whereas, you know, now there's a lot more options as well. So
yeah, and people are getting fed up.
Exactly. Oh my gosh, the amount of people that have been fed up with things, like you said, you know, they come in and then they're like frustrated because they've suffered for a certain period of time because they haven't found the right team member to help support what particular thing they're going through. So
yeah, absolutely. That, and it's that coming back to that integrative approach, multi-potentialite, pulling in your own team. And some of the clients that I've had who've had great success were lucky enough to have put together their team of people that they know and trust, and they know exactly who to see and when and for what reason, and it's creating a cushion of healing, so that and then even once they're done their healing process and they get re-injured, they know exactly who to see, and they just immediately go back into their community support.
Absolutely. It's like stocking your pantry ahead of time.
Yeah.
And I like it. And I know for myself, like, it's interesting, this year I had a knee injury, and it's one of these things, I've never had knee injuries in the past. And so I have my knowledge and my background on how to work with it, but then to talk to my friends that are acupuncturists or osteos and hear the different stories and the different things I can approach, they're also doing their own research and have their own knowledge, so they can pull in other little pieces of that puzzle. So yeah,
absolutely. Wonderful. Okay, so one of the things, so we were talking about the client experience, what kind of questions would a prospective client, should they be asking of their registered massage therapist when they're coming in? They're saying, okay, I've been injured, my doctor said I need to go see a massage therapist. What are the things that they need to be thinking about or asking ahead of time when they're meeting a massage therapist for the first time, or potentially, hopefully interviewing, because I do try to get people to understand that if they've had one bad experience, that doesn't necessarily mean that that's going to nix the whole profession, that sometimes you just have to figure out where the right fit is. And so what would you say to prospective clients?
Definitely. So one of the first things I recommend is interview. Across the board, interview your practitioner, because it's not just that they can work with you, they can fit you into their busy schedule. It's that you feel confident in working with them. And so I'll actually attach a sheet of questions for everybody, so you can pass this out to anybody who watches this as well, so they have it as reference, so you don't have to write it down if you're watching this. One of the first questions I like to ask is, do you have any experience with what I'm currently going through? It sounds really simple, but I've honestly had clients come in and tell me, yeah, I've been seeing this person and this person. And I asked them, oh, and have they had experience? And they said, oh, I have no idea. And they've been through like 10 sessions and had no results. And I was like, okay, one of the ways that we can prevent that from happening is being just really bold in our questions and asking if there's been experience. The second question would be, if the answer is yes, is what types of techniques do they use? For me, this is where the nervous system can come in really helpful. I know I'm in Alberta right now, so there are a lot of therapists here that are cross-trained with things like craniosacral and that sort of thing as well. So if people are doing Bowen therapy or craniosacral, that can be a really helpful integration that they might bring in as well. I have like a little, let me just pull this up here because I feel like I could just go off on a tangent about all the questions I would ask, but I'd want to kind of keep it in for everybody as well. I think that that's really, really, really important. I'm a big fan of seeing if they do any type of fascial work as well. I know for myself, that's something that I start to integrate as well, particularly in chronic cases. A lot of times people can have a concussion or they can have whiplash and they've had it for 10 years without fully being able to resolve it. And what we see when we look at the fascial lines of the body is that they start getting hip issues or knee or low back stuff happening. And there's a bit of a conversation that's going between the two. So in order to come to a place of thriving in your life, more of the body needs to be addressed to help counterbalance things that are going on as well. And then my third question is around collaboration. So very similar to what we were already talking about is, do they collaborate with anyone? And the reason I think this is so important is that we all have our abilities, we all have our skill set, and we all have our knowledge that we can bring to the table, and we can come with like the greatest hope to help people. But in the end, there are limitations to what we know how to do, what we know how to treat. And so for myself, like I said, I have my own personal team, but I also have a team of people that I will refer out to because they know more than I do about certain things. And my goal when I work with people is to get them to thriving as efficiently as possible. And if it means that for whatever reason with me, it's not getting to where we need to, it's not progressing as quickly with the skills that I have, then I want to be able to help support you on that journey. I don't want to just be like, sorry, good luck kind of thing. Yeah. And then probably like the last part of that would be is after the interview is to like really check in with yourself and see if you want to work with this person. Ultimately, when we're working with the nervous system, we're working with trauma, we want to feel safe, we want to feel heard, and we want to feel like there is a collaboration going on. The amount of times I've heard people share stories of, an example being really painful pressure and feeling horrible afterwards, maybe being nauseous after, that sort of thing. And they told the therapist, it's too deep, I don't like this. And then they've gone back and it just kept repeating. We don't need to continually have those micro traumas. So we want to feel safe to say no. And we want to feel like, okay, we're working together to achieve a goal.
Yeah, absolutely. And that's such a huge part of the conversation that's left out of those who are suffering from post-concussion syndrome, is oftentimes they've been put in situations where they feel like they don't have a choice in what's going on for them. And sometimes, I find, at least here in British Columbia, that has a lot to do with whether or not they're in litigation. And if the lawyer is saying, no, you have to see this person and this person, there's definitely, again, trying to encourage people to advocate for themselves. And then if they still feel like they just don't have the ability to do that for a multitude of reasons, I try to link them up with an occupational therapist who can then be their advocate, right? So they don't have a fully vested interest in a particular therapy. They're just like, okay, I am your advocate, and so what's working for you? And so that way the client also feels like, okay, I've got this other person who's in my team who's really looking out for me and creating a safe space.
That's really beautiful to hear.
Important.
Well, and I think that's it too, particularly if you're in pain. Pain drains so much from your body, and particularly if you've got a head trauma, you a lot of times are in a survival place with your life of trying to do things. So to have the ability or the time or the energy to be able to advocate for yourself or to try and find another practitioner, often it's not really a possibility. So it's great in BC that there can be an occupational therapist that can support that process.
There are some, I was hoping to bring in an occupational therapist as one of our talks in the future, but there are some that are in private practice that you can call and just say, hey, are you taking on anybody? Sometimes they're working with specific clinics and that kind of thing. Are you still there? Or did you freeze? I think we have a frozen Mandi. Can you hear us, Mandi? Oh, are we back again?
We are. Technology.
I know. I was just talking away. I was like, I think she's frozen.
Yep.
So I know we've talked a lot about different points of view. I just want to kind of come back to let's see. I think I want to ask this question next in terms of what do you feel like is missing from massage therapy training from an allopathic perspective? So, for example, if a new massage therapist was watching this talk today and they're like, oh yeah, I had this post-concussion situation and it got worse and I don't know why. What are some tips that you can give massage therapists who are interested in kind of going down this path?
Absolutely. So I have a really interesting philosophy around this, so I'm going to just be creative and share it. One of my biggest things that I think is missing within massage therapy in terms of training is a mentorship program. I think this is something thankfully I sought out myself, and has been 100% one of the greatest tools I've had, particularly for the longevity of my career as well, to talk to people who know more, who've been in the game longer, who understand things. So the first thing would be like to find mentorship. And I think if we had that built into the program, it would be really, really wonderful. Secondarily, more work with the nervous system, particularly around trauma. Being somebody who's trauma informed and somebody who specializes in it, I see it all the time, be it a micro trauma or a micro trauma. It can be really, really impactful in many, many different ways. And so if we have that trauma-informed approach, we can understand how to work with people as opposed to potentially hurting them or harming them either long-term or otherwise. And then in terms of actual treatment approach, really perpetuating the idea that the client does know best and that no pain, no gain is not the case for many, many different types of injuries as well. And, you know, I can go on from there, you know, different types of fascial work and lymphatic and that kind of thing, but yeah.
Yeah, most definitely, right? Like there's just so many different modalities that you can pull into therapeutic practice that you can utilize and build off of and really get feedback from the client for sure. So, well, the final question then for today is, and I know because I know people are going to want to know, what can they do at home for headaches? So is there anything that you, in a general sense, because I know each person is individual with what's going on with them, but is there anything that you've been giving your clients to do at home to help ease the pain and tension?
Absolutely. So I have kind of three go-tos that I like to share with people. The first is actually a form of supplementation. The supplement is something called magnesium. It's responsible for over 300 different chemical reactions within the body. And it's actually what I use to cure my migraines. I had chronic migraines for a very, very long time. It's a precursor for serotonin, which when it comes to like head trauma and brain injury, can often need to be replenished and supported. It's also a muscle relaxant as well. And this day and age, particularly right now during the virus, and even just in our day-to-day when we're working, stress levels are just absolutely through the roof. And so often the body is actually utilizing that magnesium in order to create serotonin versus to help the body and the muscles relax as well. So that's usually one thing I recommend. And there's actually a book that I'll recommend for people. It's called The Miracle of Magnesium. And I'll add that to the little handout for people too. So if you want to read about it, it's absolutely fascinating, be really supportive and really, really helpful for a lot of people. And it's one of these type of supplements that the vast majority of people, like with vitamin D, are quite low on anyways. And so that can be helpful. Just to backtrack, I always check in with two other things. One is, are you drinking water? And two, have you been eating?
Yes.
Funny story. I had this happen actually last year. I was experimenting. I love experimenting with different things, and I was experimenting with intermittent fasting. And I was noticing I kept getting headaches. I was like, what is going on? I never get headaches. And what it was for me is just that I needed to eat more frequently. Like there was actually more food that my body needed, and it was actually producing a headache. And it's been funny since I had that awareness, having that conversation with clients and even friends, and they're like, oh, yeah, I forgot about the idea that blood sugar might impact my head. So
yeah.
just to throw in those as just checkpoints, first and foremost, water and food. And then the other one is something called a vagus breath. So this is, again, a tool for working with the nervous system. So basically what it is deep, deep belly breathing. And the story I like to tell with this is if you're in sort of a heightened state, so a fight or flight response within the body, the entire body will be in this ready state and ready to fight kind of thing. And so the idea being that there are certain breath techniques that will actually help bring the calming system back online for you. And a lot of time when we're in that stress response, the head will actually, the muscles will tighten, the fascia will tighten around the neck and around the head and cause that headache. So the fun story I like to tell, and this is a good one for remembering at very least, if nothing else, it's silly. If you were to imagine you were being chased by a saber-toothed tiger, so we're going back in the day, you're caveman and you're running away, you're in fight or flight, you're going to be breathing very shallow in your chest. You're not going to be allowing a lot of it to move down into your belly. You're running away as fast as you can. And when you finally get away, the first thing that you do is you take a nice deep breath in, go, and what's actually happening internally is that you have something called a diaphragm right underneath your lungs. And that diaphragm, when it expands and when it contracts, actually massages something called your vagus nerve. And that action, that's, linked right into our body, our physiology, that is actually a tool to tell the rest of the body, like, we are safe, we can relax, we can let go. So by taking the opportunity to consciously take those nice deep inhales and the exhales out of the mouth, we can actually get the rest of the body to relax. And it's amazing how after just a couple breaths, you're like, oh, okay, that headache's gone. And suddenly I'm just feeling a little more in my body. I'm a little ready for the world.
Well, that's amazing. And it's a great analogy, right? Like that, because that's exactly what you would do if you were running for your life and then the threat is gone. That's exactly what you do, is you're like, okay, here we go. And so that's an amazing technique to remember.
Yeah, it's a breath hack, if you will, that can be really, really fun. And it's great too, because you could use it in different situations. And often it's funny, I've had people like relay this back to me when I've shared it to them, where they've gone out in the world and they were like, I just realized my shoulders were like coming up and I didn't realize it was in like this fight or flight response. And I remembered like that feeling. So I did a couple of those breaths and suddenly I felt better. And it wasn't even necessarily a headache related response. It's just that their lives can be so stressful. Our lives can be so stressful that we don't even realize how our body responds, right?
Sorry.
Good. You okay?
Yeah, no, I just got a surprise. The joys of video calls.
Yeah, very unpredictable. And actually, I should apologize. I don't know if anybody could hear. There's construction going just outside of my place here, so hopefully there wasn't a lot that came through.
No, I can't hear the construction.
Yeah. Okay. Awesome. And then, so for the third one, I know I kind of jumped around a little bit and I threw in those little extra pieces, but is the ventral vagus release. So this is, again, another nervous system response. And so a lot of times we will actually have tightening in the occiput, in the back of the neck and the sides of the neck when our nervous system is tight or it is engaged. And so one of the tools, and maybe what I'll do, because I've got actually a video, so I will maybe send a link along too for people to reference. But essentially what you can do is you can place your hands on the back of your head, right where that bump is.
Yeah.
And so it's really, really neat because you won't necessarily feel anything, but if you look left and right just while you're doing that, you'll actually be able to feel movement in that area. And that's actually what
we talked about this last week, actually.
Did you?
In my unit, well, it's week 1, unit 2, but we talked about the link between the eyes and the suboccipitals. And one of the things was, you can actually feel what's going on in the back of the head when you move your eyes, which is super fascinating.
Yeah, absolutely. So this is really neat because you'll see, even just if you're sitting on your desk at your computer or you're on your phone, a lot of times we have leaned forward and that's going to be really tight. So I'll recommend this if people have had concussion or whiplash to actually do it on the ground because it's a lot more supportive and easier. You're not engaging the arms, and just to have your hands and like a pillow, you want to be comfortable. Yeah. And then what you want to do is you want to just very gently look to the right. And you want to hold that. You want to actually feel maybe even just a little bit of tension within your eyes. Yeah. And continue to breathe when you do so. And as you do that, what you're going to be looking for is a sigh or a calming sensation. So this is a nervous system hack that can relax everything. And so basically it can last honestly up to 2 minutes. The first time I did it, I was in a really engaged state and it took me 2 minutes and I was like, this isn't working. What the hell's going on? You know, I'm like in my brain about it. And then all of a sudden I went, and I was like, oh, okay, that's interesting. Yeah. And so the idea being is that you go back and forth and you want to be able to engage that. And what that's doing is, again, it's kind of helping the nervous system, the ventral vagal system specifically, to slow down and disengage, as well as you're allowing those muscles in particular, which can often really trigger headaches, to actually relax, but not through having to take pills or that sort of thing. And it's unfortunate because I think a lot of times people will really push hard in that area because they can feel pain, and it actually does the opposite, the exact opposite. So
yeah, I've actually had to I think in my videos for the eyes, neck, and jaw, I think several times, I probably overdid it, but I think several times I was like, be gentle, don't dig. This is not a trigger point release. Even with clients who will take them through a sequence that they need to do and they come back and they're feeling uncomfortable and they're showing me and I'm like, you're digging, don't dig.
Don't dig. No, do not.
This is not the time to dig. You're locating and you're feeling. But if the fingers do this, we're not doing it right. Yeah. And so that's wonderful. Well, Mandi, I think this has been amazing, and I'm so thankful that you came on to present to us your wisdom and your education, your teaching. I think it's going to be incredibly valuable for people, both practitioners and clients, because again, there's going to be a lot of people who have never come across post-concussion syndrome in their practice and are thinking, oh gosh, I've got this person coming in and what am I supposed to be doing? We didn't learn about this in school, and learning, the value also of stepping back and saying, okay, I need to take a step back here, and I'm going to get you to go to this person and get you to go to that person, and then we're going to come back together. So I think this has been really, really wonderful to have you on. Now, if there's anybody who's interested in getting in touch with you, how can they find you? Where are they located? Where are you located, I should say?
Absolutely. So I am currently in Calgary, Alberta. And if they want to get in contact with me, I can be found on my website, mandimack.com. And then I've got all the regular Facebook and Instagram and that sort of thing if you want to follow along and see sort of tips and tricks along the way and things that I do.
Wonderful. Excellent. Okay. Well, I think that wraps things up for today. And I'm sure if anybody has any questions, they can post below on the Facebook, and we can address any questions that come up. And I just want to thank you again. I hope you have a wonderful week, and I hope to see you in person sometime soon. I don't know.
Absolutely. I'm hoping if we can start traveling, I want to get out to the island and see everybody. I miss everyone so dearly.
I know. And it's, and I've not yet been to Alberta, and I have people in Alberta that I would also like to see in Calgary as well. And I have to say, I may have said this in the intro, but I have a couple of great massage therapists here, but honestly, I so miss your treatments.
Thank you. I feel so honored.
When you come back here, I'm going to have to be like, okay, so now I'm just going to pay you to give me a treatment on your vacation.
Yeah. You know what's funny is I actually still have clients out there that will randomly message me too. So maybe I'll rent a space and do a couple days, do a workshop and do some clients and stuff too.
You can rent space where I'm at. We've got a board room. We've got room rentals. I can set you up. for sure.
Let's talk more about that. I love it. Well, thank you so much, Janet. It's been wonderful chatting with you, and thank you for everyone who listened as well.
Thank you.
Take care.
See you later.